I'm thrilled to bring to my community today Dr. Luke Fochi and Therese Murray.
Okay.
Going to give you a little brief introduction and then hand over the mic here. But Dr. Luke Fochi is a hospitalist and a BHRT, which is a Bioidentical Hormone Replacement Therapy and Wellness Medical Director of the Lux Men's Club in Chicago, where he cares for patients during their most acute and complex medical moments. And then we have the beautiful Therese Murray over here that brings more than 32 years of clinical experience across critical care, emergency medicine, neurosurgery, and cardiology. Her commitment to precision and patient care led her into aesthetic medicine, where she trained alongside a world-renowned plastic surgeon in Chicago and discovered this intersection of both medical science and artistry. And I feel like this could maybe be our jump off for both of you of really describing what we mean by that. Like, what is this medical science artistry? How does that fit into your realm of what you have pulled together today as a team?
Well, I mean, my experience, especially when I worked in plastic and reconstructive surgery at Northwestern, so it's a tertiary hospital, academic, so I was able to get both of the aesthetic part with the Botox, and we were doing surgical stuff, as well, like facelifts, neck lifts, that body stuff, but then also reconstructive aspects. So we would see people that were post-trauma, women post-mastectomy that were coming to get their reconstruction done. So I really got to see the whole spectrum of aesthetics. Again, the reconstructive side, where you're really just kind of bringing people, giving them their life back, their dignity back, their confidence back. And that's when I really fell in love with aesthetics and realized it's more than just Botox to the face, because we can use Botox in a lot of different places.
Agreed. Yes, thank you. That was a wonderful explanation. And the next question that's kind of following this is just, do you both see this shift happening of anti-aging, thinking more of just that Botox type thinking versus this aging into health and what that looks like?
Yeah, I think it's come a long ways, whereas it's not just the outside, the aesthetics part. That now in this day and age, a lot of it is the hormone replacement, the peptides that are a new thing, the GLPs. Because once you feel good, I mean, it doesn't matter how good you look outside. If you're worn out, if you don't feel like you used to feel, you can look like a 10 on the outside and feel like a 2 on the inside. And so you need to bring both to the table.
Yes, that's a really great way to describe that. Yes.
I mean, the HRT brings functionality back. So you can get your hair done and you can get your lips filled. But at the end of the day, if I'm not able to comfortably, let's be honest, have sexual relations, that's tough. That's the intersection, I would say.
Yeah.
Okay, you open this door, so let's just dive right in.
Yeah.
Okay, with this hormone replacement therapy, I feel like for some reason, this day and age, we're still at this part where some people are on board, they understand the safety of it, and then we still have physicians on the other side who don't. Can we kind of just break that down for a second and how you as a team talk to your clients about it? Because they might be getting kickback from, like, they can come to you and then walk through another medical professional's door and be told something different.
Yeah. So I've done it on both sides where I've done it in like a private practice clinic or also done it now at the med spa. And part of the reason is when you're in the private practice clinic, like say you go to your PCP and you're like, I just don't feel like myself. Can we do a hormone panel? A lot of them don't learn too much about it when you're in med school or even residency, depending on what you did your specialty in. And then on the other side, your hands are kind of tied as far as like what you can do once you get labs back. There's a wide range that they consider normal for your hormones. So like if someone's at the upper end of normal, they feel great rather than someone's at the lower end, but they're still all considered normal. So insurance isn't going to cover hormone replacement therapy for someone that is still normal, but they're like right there at the edge. So the nice part about what we do is it's a fee for service. It is a luxury to be able to come in to afford it. But my hands aren't tied by insurance telling me what I can and what I can't do. We have multiple women and men who come in. We had one lady who called our spa a while back and she was like, I've been trying to get in with my OB-GYN, my PCP, and no one will take me. And I was like, well, you can come in tomorrow and we'll do your full panel and get you set up. And so I think that us just being available and then we track you the whole time that you're on whatever plan we come up with. We repeat your labs. It's just a safe way.
Very comprehensive way. And I remember we have a nurse that we take care of, and she's actually nurse manager at Northwestern. And she came in to talk about weight loss. And then, of course, she's middle-aged, and so hormones came up in our conversation. And she was like, wow, I can't believe you're talking to me about this. And she started crying. And I was like, well, what's going on? And she's like, well, my doctor told me that she put me on her doctor, she put her on an antidepressant for her hot flashes, told her to wear layers. Just take off your layers. I mean, this is what we're doing in 2020. This was 2025. This is what we're doing. Yeah. And now she's on track, very happy, not on an SSRI. I mean, it's nuts. Yeah.
It is crazy, and it's also so hopefulling to know that there are other answers. There's other areas that we can dig and find benefit. And just a little bit of my backstory with clients, because it would have been so refreshing to walk into your doors as well. I feel like podcasting was the first thing that really introduced me to, hang on, we have some other options. And I live within this population, this clientele, who all need to be talking about, they're all the ones with the hot flashes and the not sleeping well and the feeling more depressed. And you could literally rattle off all the symptoms, and every one of my client has 3 to 4 of them. And here I wasn't even living in a land able to talk about it initially. So then once the podcasting piece came up, I'm like, now where do I find the people? How do I find all these professionals? I'm ready to jump on an airplane, and now have finally been, again, a little bit able to find local. So I love your story of somebody walking in your door and just going, oh, I found you.
Yeah.
Yeah.
I think you're
It's
going
a
to take
nice
care of
feeling.
me.
It's a nice
Yes.
feeling.
So, because again, it is luxury, I hear you, but you do take care of your people. So, kind of
Yeah.
describe, because to your point, how often are you following up with the labs? How often are you following up with the person if they have questions? Like, what's that kind of support system that they're getting?
So, what we do, so your initial intake with us, you come in, what we like to do, because doctor is still in the hospital, so we kind of plan this out. So where, they come in, talk to me initially, I take their intake, make sure that they're a good candidate just in general. And then we draw their labs, send them off to the lab, and then we book a consultation with Dr. Fochi just to make the best use of everybody's time. And then they sit down with mostly Dr. Fochi and me. I come up with like a little plan in the back with either GLPs or peptides. And then doctor manages the HRT, and we just come up with a plan. We see them every 3 months. We'll draw their labs again at 3 months, make sure they're feeling good, their labs look good, and then annually or semi-annually for labs if needed. But our patients have full access. This is concierge medicine, so we have patients, you can text us through our phone number, and me and our team are always answering questions. How are you feeling? We check in, we do patient callbacks, we check on patients, make sure they're doing well. Do you have any questions? We send follow-up emails. This is what you should be expecting about 4 weeks out. This is what you should be expecting about 8 weeks out. Just giving them some guidance, letting them know that we're there if they have any questions. But honestly, there's really never any issues.
Yeah.
Everyone just starts feeling great around week 6. Typically, they start feeling great, and some really great results lately. We had one woman in particular, we talked about our last podcast. She's like 55-ish, but she was having so much discomfort that even walking would lead to bleeding for her. So she could not even consider having sexual relations. So doctor put her on testosterone topical, estrogen patch, progesterone at night, and then estrogen suppositories. And within 4 weeks, she came in for a follow-up, and she was over the moon already. Like, I'm back to myself down there, which is incredible after years of not feeling that way. Yeah.
Right. That's game changing, life
Yeah.
altering.
Yeah. Think about it. Yeah.
Yes. So it's funny, I've sat in with a lot of my clients for their consultation with hormones. And one of the things that I've noticed is when you're sitting, and I would imagine the same thing, coming into your office, hearing what you have to say, you feel very confident, you get excited about going on these hormones and that option of feeling better. And then when you exit the doors and you like start them, there can be this feeling of a little bit of panic. It's new. And again, some physicians, I know me personally, I walked into my gynecologist's office and she's like, what are you doing? I had a panic moment. My sister had a very similar moment. How do you walk people through this journey, pull them off the ledge to keep reminding them? This is the science. We are following science here.
I don't have any issues with women. It's men.
Yeah. It's just with my men.
Yeah, it's men that are the most neurotic. I think women are just more comfortable with doing different interventions and everything that we've done to ourselves over the years. But it's the men that have typically the most questions, the most anxiety. Interesting. I don't really have it with women.
I also feel like, women, your whole life you've gone to the gynecologist, you've talked about your vagina. Guys don't ever talk about their libido, their erections, things like that. So they're so
just
shy at first to come in, and then they're very, should this be happening or this be happening? And then once they feel good and they get to that point, then I have the opposite where they're like, well, now I don't feel as good anymore. And I'm like, no, this is just your new normal. You're not going to have that big spike and feel great. Like, you got to calm down.
Yeah. Sometimes I think men have higher expectations from it, whereas women are just happy to feel kind of functional, normal again.
That is funny. I've heard the opposite too, that the women can be the stinkers. It's probably all who's the most researched at the moment.
Yeah.
And has the most comfort level. Yes.
Yeah.
So can you walk me through a little, because I feel like here's the other, depending on who you're listening to, transdermal versus oral versus patches versus pellets, you can be pretty well researched and still catch a moment where you're like, well, maybe I don't understand that.
Yeah.
To me, I mean, they're all different. They're all different in how they're administered, how they're absorbed, everything. We don't do pellets. I don't really like pellets because you can't adjust it once they're in there. I'd rather be able to tinker with the dose with oral or transdermal or the ointments. But really for us, I mean, I'm very relaxed and chill when it comes to what are you comfortable with? What are you going to do? And what are you going to stick to? If you're someone who can do a suppository, great. If you're going to stick to that, then let's do it. If you're someone who can't, if you're someone who will do the cream every day, great. If you're someone who can remember to take a pill, whatever you're going to be compliant with.
Yeah. I mean, for myself, I'm on the whole spectrum. And I started microdosing testosterone injections daily. And for women, our dose is so much smaller than a man's dose. But I went to this hormone conference in Orlando a few months ago. And when a physician was talking about that, and it kind of makes the most sense because that's sort of how our hormones work daily. And I take a lot of peptides as well. So I'm giving myself all the injections anyway in the morning. I don't mind, but it's such a small amount. But I can't explain to you the difference. I was doing topical for over a year and I felt better, but I didn't feel great. I didn't have the libido back. I just didn't have that same amount of energy. And so I started microdosing and it was literally like a fog lifted for me, like this kind of clarity that I have now and energy level and all of the things that you would expect. So I love the microdosing. I've talked to a lot of our clients. A lot of my friends are our clients as well. So I've talked to them on the side, well, like, hey, why don't you try, instead of that 2 big or 1 big injection a week, it doesn't kind of make sense. You get peaks and troughs. And that kind of, I think, drives the men crazy a little bit too, because they get used to that peak and that trough kind of stinks for them. But the daily little micro injections have been fantastic for me.
Yeah, see, this is a perfect example because I'm the opposite. I try to do daily and I just am not someone who's compliant with it. I can do 2 days a week to do my testosterone, but every single day having to wake up and do a little, I wasn't doing it. So I was like, you got to go back. And also, whenever we start someone on something, if they don't like it, we can always change it up. You're not locked in.
Right. That's what's nice about it.
You can always tailor it.
Yeah.
And what a beautiful example of medicine for individuals, that it really is such an individualized experience and what's their real life circumstance can allow them to adhere to. I do have a couple more questions with that though, because I've heard some studies that the transdermal gives the benefit of symptom relief, but not enough to elevate the blood levels to give the protective bone and protective heart benefits.
Yes.
Is that accurate?
I mean,
Obviously, transdermal, there's going to be less absorption.
I think they say something like 15 per, maybe like.
Yeah, so you're going to get some of the benefits, just not all of them. But again, it just depends on what you're seeking to get out of it and what you're going to be compliant with.
Yeah. But it is so important for women, like women that, my aesthetic patients will come in and start talking to them about all this. And it's like, why aren't you on? Like, why aren't you? I don't know. I just don't think I need it. And it's like, I don't think they truly understand. They're not getting that conversation with their PCP about the risks, their cardiovascular risk mimics men's once they hit menopause. And like for a woman with osteoporosis, they take a fall and they have a hip fracture, that could be catastrophic. 15% of women don't make it.
Especially when you're older. I mean, I see so many women in the hospital, they come in elderly, very elderly. They've broken a hip and all I can think is it's a downhill slope from here. It's just so hard to come back.
Yeah, we all know when we hear our friends say, Grandma took a fall and broke a hip. I mean, the medical people are all looking at each other like thoughts and prayers, because that's a death sentence for a lot of women. Yeah.
Other thing with the PCPs and stuff is I give them a pass because they're already so overwhelmed. They're the lowest man on the totem pole when it comes to the medical community, but they do the most work and are paid the least. So they don't have time to sit and spend, an hour with you to discuss everything. You're in and out. And so I feel like we're a good resource to take some of the burden off of
Yeah.
them.
Yeah. We like working with the physicians, even when it comes to weight loss. There's still patients that come in and their doctors just are not interested in GLPs, or they have that old mentality of do it the hard way, try harder. CrossFit, that's not FDA approved, but go do that. And so it's like, we work adjunctively with them. We'll let your doctor know. We send the doctor their lab work. We forward them our notes. We want to work collaboratively.
We've only had a couple who get their feelings hurt. Their patients over here. I was like, look, sorry.
Yeah. No, sorry.
Medical professionals are used to working with a team, right? A multidisciplinary team. It's so important.
Yeah.
And I do agree. I think that you can lift that burden. You have that hour plus in the office to actually look at the whole body and ask all the questions and the whole medical history, which is worth the self-pay in my mind of having somebody truly listen to every little detail is so comfy. Yeah. Yes. And you started to say this, Therese, but when it's interesting that sometimes women don't even know what they're meaning to ask for or going on the HRT for, because I know that a lot of my clients want the heart benefit and the bone benefit, but then they're prescribed because they've gone through not a U type of a clinic, and they get the transdermal, and then when they go in somewhere else and get their labs drawn, their numbers aren't optimized for the other benefits. So it's like, even when somebody's trying to seek out something, we can still get stuck in too low of dosing because maybe that's the comfort level of that referring physician. I don't know. Do you have thoughts around that?
Oh, for sure. And I mean that's the fact even with weight loss medications that we've learned. It's just kind of just keeping them at starting dose. And again, it's just, this is fine, you'll do. Yeah, no titration, no explanation, no bringing them back in and reevaluating. And that's what concierge medicine is. It's we bring you back in. We've had patients that we're basically doing the same treatment plan. We're just giving them more of an explanation. They're they don't explain anything to me.
And more follow-up. It all depends on how the provider's trained.
Yeah.
It doesn't mean that they're doing it wrong. It doesn't mean that I'm doing it right. It just depends on how you were trained. Not to talk down on anyone. But I feel like we're almost neurotic about it. You're going to come back and get your labs drawn until we are at a good number, but also that you feel good too. You treat the patient, not the number. Just because the number is okay, but you're not feeling well enough. Okay, well, then we still need to adjust some things.
Yeah.
And then once we get you to a good level, you're feeling good, then we can be all right, well, we're not changing anything. You'll stay at this dose for 6 months, and then we'll come back in and make sure that everything's good.
Yeah, I think it helps, especially for our women clients, because I'm older than most of them, and I explain everything that I've gone through with them, and we have a great relationship with our clients. And I didn't expect to hit it off so much with women because I typically hang around with gay men, and so I was wow, ladies like me. But it's once you let them know, I'm a grandma, you see me out on weekends on Instagram. I have a lot of energy, and I still have a lot of life to live, and they like that. They they like to live a little vicariously through me in an empty nest.
It's also nice. You guys always say she's our resident lab rat. If there's something that you want to try, she's already done it or she's on it, so she can give you a first-hand testimonial.
Even on myself.
And then I'm the same way for the guys. I'm oh, well, I've done this. I already did this.
I'll try it.
I'll always be willing to try anything.
Yeah.
I think that's important. If you were worried or whatever about it, then the person sitting across is going, wait, why should I not be jumping on this? Can we talk peptides? And if I'm missing anything else on hormones, bring me back to it. But let's have a peptide conversation while we're at it.
Yeah.
What are they? Let's bring in the general population who's going, I'm hearing all about them, and what the heck is this?
Yeah, they're definitely very popular right now. And so basically, they're short chain amino acids. These are proteins that exist within our bodies already, but just like everything else, as we age, things slow down a little bit. And they're just basically very specific messengers. And there's different peptides for different things, but they're little messengers that come in and just tell your body to start activating again. Let's just use one, for instance, that stimulates growth hormone. A nice thing to do versus steroids or human growth hormone. So one peptide will stimulate your pituitary gland to release more of your own human growth factor, but it's not going to to force it to over-release like steroids would do. So it's going to tell your body to do it the natural way.
Yeah.
And you cycle that like 5 days on, 2 days off, so you don't exhaust your pituitary gland. But that's going to help you with lean muscle, getting rid of visceral fat, just great anti-aging in general. But there's peptides for everything. For collagen stimulation. There's one for anxiety and for brain stimulation that I take. That's Cilac and Cimax. I take those every day. Fantastic. I mean, my anxiety has diminished significantly. Now, I'm not sure if that's related to the testosterone because I'm spinning plates all over the place, but it's great. I mean, I used to be a little more anxious, nervous. I'm not chewing my nails anymore. And that's like a real thing. So there's just plenty. I think I take about 8 a day.
She's the peptide queen. When I say she's a lab rat, she is a lab rat. She will get on every one. I can't do 1 injection a day, and she's over here doing 8.
Yes, yeah. But there's then not a peptide. NAD is not a peptide, but NAD is also very popular. I love that. And a lot of these you can get in nasal sprays too. So if you don't like doing the injections, C-Max and Cilac come in a nose spray. NAD comes in a nose spray. I love glutathione, not a peptide, but I love glutathione. I mean, that is a big detoxification. So that's great for your liver. So I use that. And it's great for your skin as well. So I inject that twice a week, a bigger injection. But yeah, they're great. But again, keep your expectations. It's going to slow things down, but don't expect
Not crack. It's not like you're going to
all right,
I'm ready to
it's
go.
like substance,
That's one of the hard parts about what we do is always setting the patient's expectation.
Yeah.
So it's not a miracle drug. You got to go slow, and some of them take time to kick in. It's not like as soon as you do it, you're going to be wired and ready to go. You got to give it time. And also you got to start low and go slow. We don't want to overkill it.
We do a pretty good job of rooting out body dysmorphia. We don't really get a lot of body dysmorphia.
No.
I think that's not a big Midwest thing. It happens occasionally, but it's not too crazy.
Well, I was going to say, I think the interesting thing that I see in my clientele is a hope that hormones or peptides will be the answer to weight loss. And I think what we continue to discover is that they're fixing the other symptoms, the brain fog, the depression, the anxiety, all the things that can be our barriers to getting in the workouts or eating healthier or whatnot.
Yeah.
And it's once those components pull themselves back together, then the weight loss is a side benefit versus this answer to weight loss, right? It's a piece of the puzzle.
I tell that to our weight loss patients. I mean, the GLPs are peptide. I tell our patients that stop focusing so much on the weight. This is just a full metabolic regulator, especially we have PCOS patients. And this is internally fixing so many different things. We ask our patients not to weigh themselves as well. We ask them to weigh, just don't buy a scale if you don't have one. Come and we'll weigh you once a month. Free yourself from that. That's part of it. Liberate yourself from that madness. So just let us weigh you once a month. Don't focus so much on the scale. There are so many amazing things happening on the inside, especially with the GLPs. Let it just take its course and the weight will come off. For some people, it can take 6 months to 9 months to really see a big difference. But we're not a patient society. And everyone's looking at TikTok and they're seeing 30-year-old girls who have 10 pounds to lose. You know what I mean? It's different than the person that's been clinically obese their entire lives or that PCOS or that are pre-diabetic. It's just, everyone's different. So we have to ask people to take a breath, take a step back, but they're afraid they're wasting their money. They're like, this is expensive, $500 a month. And it's this is just not about weight loss. This is so much more.
You also don't want to lose it that fast. That's not healthy either. 1 to 2 pounds a week at max.
Yeah.
And also I think they don't understand that that appetite suppression is actually a side effect of it. It's not what it's supposed to be doing.
Right. It's that extreme appetite suppression. In the beginning, it happened to me, and I was I had a
she
version.
could not even eat.
My friends were no, they were very nervous. And I was that's fine. Now I've gained weight back. I look healthier. And it's now I have my appetite back, but I just don't.
Food.
Noise.
Oh, I'm bored. I want to eat.
Yeah. I mean, I still have food lust, but I'll have a piece of pizza, not the whole pizza.
I love the food lust. I have not heard that.
Yeah.
But let's talk GLPs for a second. So you do prescribe
Hmm.
GLP-1s as well.
Yes.
Yes.
Yeah.
And just the safety measure with those. Are you looking at patients' muscle mass? Do you have a scale in your office that provides that? Like what type of
Yeah.
talk goes around this setting of expectations?
We don't have a muscle mass scale. I've actually thought about doing that. I would like to partner with a DEXA scan company to get like that full. 'Cause if you've ever had a DEXA scan, they're amazing. And you know how we love data about ourselves with our Whoop. I mean, we just all
Yeah.
love
Or
getting
things.
that. For GLPs, they're so safe. They're so well tolerated. They're not new. They've been around for a long time. Tirzepatide is like the newer iPhone, and then now Retta's going to be out soon. But
Yeah, I
that's
just
that's the iPhone 17. Like
yeah.
that's the real game changer. That's one that has glucagon. It's a triple agonist. So that is muscle sparing. I actually take that one myself. And that's when I put that weight back on. I just look better. I just see more muscle in my legs. I just have a better frame. I looked very frail
Yeah.
and I was looking like that little old lady who was going to break a hip.
Yeah.
And,
I
and
like this bit.
yeah, that's not a good look. And so we walk people through that. We encourage them to make sure that and it's hard to do, to eat a gram of protein per
Body weight.
pound of body weight or goal weight. That's hard to do, especially in the beginning. So we try to coach them on different things to eat, even if it's string cheese or a chomp or something. Just do something to get that protein in. Put some cottage cheese in your eggs. But yeah, we've seen some people go get a little too thin, and then we back them off a little bit. But patients are really reasonable. We've not had any issues.
Yeah. And even the weight loss patients get a full panel blood work
Yeah,
before they get
yeah.
started.
Yep. Make sure. And how many pre-diabetic and type 2s have we diagnosed that had no idea that they were? So they're like, no, I'm fine. I'm just fat. I'm healthy, but I'm just fat. And I'm like, okay. And then you get your labs and it's like, okay, well, you weren't healthy. You were a little ticking time bomb. The things that we see, that diabetic patients that smoke, and it's just like, do you understand that those are the
You're gonna
two
lose your feet.
you're going to lose your feet. Yeah. So I mean, the things that we've seen in the hospital that we can bring back to the clinic and explain to people like how dangerous it is to have that lifestyle. We talk about that with testosterone too, with men. Again, this you're more women focused, but men can tend to want to go overboard with testosterone, and they don't understand the dangers that come with that.
Yeah, I had a guy because like we give our guys the vial of testosterone and I tell them how much to draw up to do. So there's some trust there, you're going to do what I say do. And then I have one patient, he was just all over the place and he was like, well, I feel great. So now I'm going to do more without telling me. And then he came in and got his labs repeated. I was like, you don't understand. This is how it works. Like now your estrogen's through the roof. So it's masking everything that the testosterone was doing. It's like, there's a reason I put you on this dose.
Yeah. Yeah, so I mean, for the women, there are mostly women listening to your podcast. I mean, getting your man's labs, your husband or your boyfriend's labs checked out and bringing them back.
Yeah, we've had like aesthetic patients that come in and I'll be there and they're like, oh, so what do you do? And I explain it. And then they send their husbands or their boyfriends in. And they're like, you need to go in and see him now.
Yeah, absolutely.
Which sometimes guys need that push. Like I said, they're just not willing, they're taught, oh, me man, me strong. I don't need to like do anything.
Yeah, well, men live longer when they're married to women, and women don't. So yeah, we definitely support men's health inadvertently or if intentionally.
Yes, I don't think you could do one without the other. I do feel like all the women that I have seen come through the doors the husband happens. And maybe it's months later or years later, but the husband enters the doors at some point because there's something for him. I don't want to leave this moment because I think this is really important for my community. I have so many women on GLP-1s who are seeing the social media. You're saying this blast of like people, the weight's just falling off. I'm down 50 pounds. I'm down 100 pounds. That is not the normal for my community. I feel like we've got like more of the women with the central nervous system hijacked at the moment, dysregulated. And I just feel like you started to mention it, PCOS, prediabetes, insulin resistance.
Yeah.
And I like that you threw out 6 months because I'm trying to get in this, like, let's set expectations. If we can get rid of the scale, exist on it. You're saying it too. You believe 6 months, a year, it might take that long for them to actually see the scale catch up to all your other success factors.
I mean, I have a girlfriend, beautiful, but fought with her weight her entire life. And she did all the hardcore training, everything that's not FDA approved CrossFit. I mean, she ended up with cauda equina from CrossFit, which is a terrible neurosurgical issue. She was on semaglutide. So that's like the clunkier one. This is the only one that was out. and she was on full dose and not losing weight. And I mean, I remember we were at brunch and she was in tears, like, how come this isn't working for me? And I wasn't managing her, but her doctor kept her on it. And now, over a year later, I see her on social media and she looks stunning. She's just down. She's lost all the weight, but it took over a year for her to really see that significant weight change. It was like 15 pounds.
Yeah.
But I mean, when somebody's 275, it's going to take time.
Yeah.
But people just aren't patient.
No.
Yeah.
And the immediate
Yeah.
result.
Yeah.
If you do it without, if you just diet and exercise, it takes months before you look in the mirror and you see it. Like, it's not a fast process. If it is, then you're doing it wrong.
Yeah.
Right, and it's not as healthy. They could be losing muscle mass with the fat mass.
Yeah. The reality is you will lose muscle mass on these medications initially. I mean, it's hard to get that protein in, do the weight training. And then there's different things for different ages. For women of my age, doing HIIT classes really is not really. I don't know if you follow Dr. Stacy Sims. I love her. She's wonderful. Talking about women of menopause, like Orange Theory and the F45 aren't really truly HIIT classes. So it's sort of that moderate, it's raising your cortisol levels. It's really not bringing you where you need to be. It's really weight training and those really intense bursts of 80% max for 1 to 4 minutes. So it's doing it the right way, doing it for your age. The way I used to work out like a maniac, it was not the way I should be working out now. So it's that kind of guidance that we try to offer them as well.
Which is huge because, man, we were creatures of habit, banged down the same door that worked when we were 20 and 30, and now all of a sudden it's not working anymore.
Yeah.
Hey, poke holes in my theory here with the titrating of the GLP-1s, because in my mind, it makes sense if it's working enough and then they have all the other lifestyle habits working with it. Then I see a medical professional titrate them up and I'm like, why do we have to go up? I feel like, wouldn't it make more sense to stay and then get the benefit, keep as much muscle mass as possible, and then even if they want to go off of it, maybe it's easier to go off of, or am I making something up in my head?
So no, I agree with you. We do the same thing. I know that like some patients that we've seen, their doctors kind of just let them free ball. They're like, you can titrate up as whenever you want, or they put them on a schedule. Like, so every 2 weeks to raise it up. I'm like, what? Yeah. I tell my patients, unfortunately, we have to charge you more the more that you're on. It costs us more money. But also, if it's working at a nice, steady pace, just stay on it.
It's not broken.
Yeah. So just that like raising that dose and wanting to max out right away, it's just, I don't know. To me, it just seems counterintuitive to me.
Part of it's probably the patient to be like, I want to go up, I want to go up. The physician's just like, you're worn out. It's like, you know what? Fine.
It's the patients who are closest to me that are most annoying, family members. But what do you mean? It's just like, okay, first of all, it's 10:30 at night. This is a gradual process. You're 70 years old. This is not going to fix you overnight. It takes time. It's just dealing with people being impatient, and more is more in our society. So having to exercise patience and patience with our patients and teaching patients as well. You didn't get here overnight.
Yeah. You have to be comfortable saying no. Like, just because somebody comes in and they want something doesn't mean that they're a candidate or that you should do it. We say no all the time. Yeah. In aesthetics especially, but yeah.
Well, and I'm going to flip the grid to the patient also needing to know when to say no, right? There's so many times where I'm like, you didn't have to say yes to titrating up. Like, you were happy. And just because they said it and they're the professional doesn't mean that that's an automatic okay on your end. Right. You know your body best.
Yeah. So your autonomy to make a decision. Today you should do this, but if you don't feel comfortable or something, then okay, let's change it.
We always say this is your journey. It's our job to educate you and make sure it's a safe journey. And honestly, patients do listen. They do. I mean, we had a couple that came in and they came from another clinic and they were taught to microdose the GLPs 3 times a week. I was like, okay, so you're using this purely as an appetite suppressant. You're not getting that full signal from the GLP that your body really needs to completely re-regulate. So I'm like, again, this isn't dangerous, but I said, this is like buying a luxury sports car and never driving it more than 30 miles an hour and just taking it to Jewel. So if you want to do that, you're going to get to Jewel.
That's our grocery store here.
Yeah, that's sorry, Trader Joe's.
Not the singer.
Right. No. But like you can do that and I support you and it's going to cost the same. You're not getting the full benefit. And so it's really education. And if you really explain to them with authority, then they listen and they're happy. And, again, this is easy. If you want to go back to doing it your way, if you want it, patients say, well, I don't want to be on this medication forever. And I don't want to be on something I might need to take forever. And I'm like, well, listen, there's nothing wrong with that either. It's like saying, I'm going to go to the gym, get my gym body, and then I'm going to quit the gym. This might just be the piece that's been missing for you. And there's no stigma, there's no shame in our clinic about it.
And if
It
you
is,
want to go off,
if you want to
go off. We'll always be
yeah,
here if
and
you end
I'll
up
see you in
coming
2
back.
months. I'll see you in 2 months when the food noise comes back, because it will.
Thank you. I feel like I could ask questions all day. This has been amazing. I want to
Oh.
make
Yeah.
sure for anyone who's going, oh, I wish I lived near them. Do you do anything virtual? Like, what are the best ways to
Sure.
keep following
Yeah,
you?
so we're luxuriamedspa.com, luxmensclub.com. I'm the Gold Coast Injector on Instagram. There's a mix, personal life, politics, and health and wellness. But Luxury Med Spa is straight med spa stuff on
Yeah.
Instagram. But yeah, we do telemedicine. I have a patient that is coming from out of state this afternoon. So yeah, we do see patients from out of state as well.
So you're tangible. We can get to
Yes,
you, which
Yeah.
is
yes.
amazing.
Chicago's a great city, even
Mhm.
in the winter. Come see us.
Okay, so I'm going to put you both on the spot for a minute. You both have to answer individually, but I like to end this way. If our listeners heard nothing else, if you could wrap your arms around them and make sure they walk away with one thing, what would you want them to hear from you?
For me, I say aging gracefully is very subjective. And we said this in our last podcast, we ended the same. It's like for some people, aging gracefully means not going on HRT, means not doing facial treatments, means not. And for somebody else, it means being on HRT. Maybe it means being on weight loss. Maybe it means doing the aesthetics, getting a hair transplant, whatever it is. Just go with somebody that's going to be your advocate and make sure it's a safe journey.
Yeah, mine would probably be like around the same thing. Don't look at someone else and see what they're doing and compare yourself and be like, I need to do that. If you feel good, if you think you look good, then that's all that matters. Doesn't matter that so and so is doing 20 different things. If you only need to do a couple things and you feel good and you feel like yourself, then that's all you need.
Yeah.
Thank you. So good. I love the
Yeah.
term eyes on your own paper. Right? That's what we're
Right.
talking about.
Yes. I love that.
Mhm. Thank you for your
Thank
wisdom, your
you.
time,
Thank you.
You're
being
so
here.
great. I
Mwah.
appreciate you. Take
Thank
care.
you.